I'm delighted that you're here today for our first online event of 2024. These events, if you haven't been to one before, are a great way of sharing more about the work that Habitat does in the UK and across the world. And we also want to make sure that you have the opportunity to see the difference that you make when you choose to support Habitat's work. It's also a great way of connecting with our colleagues from around the world. And I'm delighted today to be welcoming some of our really close colleagues who do wonderful work at Habitat for Humanity Malawi. They're going to be talking about their work with communities, making homes healthier and safer through better water and sanitation facilities. I'm sure you can all really appreciate that whilst a decent home starts with the physical construction of the home itself, it's so much more than that. Being able to wash your hands, to use the toilet, to access clean water so that you can cook, so that you can look after your family safely without worrying about what the water might contain in terms of disease or illness is a right that everybody should have. And that's why some of Habitat's work supports people to access this basic right to clean and safe water in their own home. And this is something that everybody should be able to do fairly wherever they live. Today, we're going to hear from the people who really know how this work happens in the community. They collaborate with families, with individuals, with community leaders to understand the real needs of the people that we work with and for. And they ensure that through that knowledge, our programmes are sustainable, that they deliver in the long term and really help people to flourish by living in a decent, safe home. I'm going to hand over to Gemma now, who's going to introduce our first speaker. Thank you once again for joining us today, and I hope that you enjoy the event.
Thank you, Henrietta, and thank you again to everyone who's joining us here today. Before we get started, I just wanted to draw your attention to the Ask a Question function and to encourage you to use that during the session. And now I'm really pleased to move on to introducing Lucy Mwaze, who is Programmes Manager at Habitat for Humanity Malawi, and who is going to introduce her role and the work that the team there do. Thank you.
My name is Mrs. Lucy Mwaze. I work for Habitat for Humanity Malawi as a Programmes Manager. I've been with Habitat for, actually yesterday I clocked 6 years. Today what I wanted to talk about, we have so many programs that we implement within Habitat for Humanity. We have the vulnerable group housing, we have the DRR, we have advocacy, we have vocational skills training, and then we have the WASH program. Today what I wanted to talk about is the WASH program. So WASH program is one of our biggest programs within Habitat for Humanity. This is a program that we started implementing some few years ago. Our first project that we implemented was in 2014, where we supported schools with access to safe water, but also improved drains. But our the WASH program has evolved for the past years. With funding from BMZ, where we implemented a project in the West peri-urban areas, in Siliza and in Tandile. So it was just a small project of about 50,000 euros, and we're targeting the vulnerable families with improved drains. We constructed some purer drains. These were eco-sanal drains. After a successful implementation of that project, BMZ gave us another follow-on project funding. So we also implemented another WASH project in the same urban areas, and we're targeting schools. So it was more of institutional WASH. After another successful implementation of that project, BMZ also gave us another funding. As of today, we are actually implementing the fifth project funded by BMZ, and we're so grateful to BMZ. In terms of WASH within Habitat, we feel this is a very critical piece of our niche, because we're looking at housing, and housing, if we talk about adequate housing, is not adequate if we don't have access to basic services. And in this case, we're talking about water, sanitation, and hygiene. And with the support, with the move from supporting institutional WASH to supporting the community WASH, we've done so many things within Habitat with funding from BMZ. I remember one project that was funded by BMZ, which we called BMZ3 in Kabudula, where we supported both the schools as well as the communities. One element that we also incorporated or integrated was production of soap at community level. So we trained mother groups on how to make soap, which could be used for hand washing, but also we also trained them on how they can make reusable pads for girls. This was to also support our menstrual hygiene efforts for girls in school. So when you look at the impact of these projects in the target communities, but again in Malawi as a whole, is huge. Like when we're doing the training of mother groups to make soap with local available resources, it was a time when we had COVID, and this came in handy because at least the communities had access to soap. So when we're promoting hygiene, washing of hands with soap, at least the community members had access to soap, which was affordable as well. And then moving on, the other thing that I wanted to talk about is that every time we're submitting a proposal to BMZ, we incorporate the lessons from the previous project. So every project that will be implemented with funding from BMZ has been something that builds on the other project. So whatever we learn from this project, we kind of try to put the lessons together and build on to see how best we can make that impact that we desire. So every project is a build on the other one. From after we implemented this BMZ3 project, we went on to support the communities with water as well as sanitation. And this is a project that we implemented in Masumbakunda, in Lilongwe as well. So in this project, we were constructing what we call co-built latrines. These are low cost but improved latrines for the most vulnerable. We did a lot of hygiene promotion for the communities as a whole, and I was privileged to visit some few communities in Masumbakunda, and you could really appreciate the change. Apart from people that we constructed latrines, but there are also other families who did not have latrines, who were motivated when they saw that other families were constructing their own latrines, and they also constructed their own. And it didn't end there. We also promote hygiene of washing hands after visiting the toilet, and almost every village, every household that we visited in that village had a hand washing facility at the latrine side. The latrine had a drop hole cover, so all hygiene elements. They had a dish rag, and the latrines were cleaned, and there was no smell, all those things. In addition to that, I think after we started implementing the BMZ4 project, that's when we also started, we got funding from Lions to implement a similar project in Choro. So we have a similar project that we are currently implementing in Choro, which is more or less a copy of what we did in Masumbakunda. So we're constructing latrines for the most vulnerable. We conducted the community-led total sanitation. We're drilling boreholes, we're repairing the boreholes, we are training local artisans. We are also, because it's got an element of advocacy, so we do coordination meetings both at community as well as at district level. But the other element that we've also integrated with our WASH program is a complaints and feedback mechanism. So everywhere where we work, where we implement our WASH program, we make sure that we also train committees on how they can also coordinate any issues that will be coming from any complaints from the communities, and also how we can address them. So we have a proper channel. We have a toll-free line that the members can use, but we also have a proper channel on how those issues can be addressed. The other thing is in our, as I said, not most of them, but almost all our water interventions have been drilling of boreholes. So as I said, that all our BMZ projects, when we're implementing them, we make sure that we take lessons from the previous project and build on the new project for greater impact. So the other thing that we've been observing was that our water, like the strategy that we use for access to water, is to drill a borehole. and this means that we rely on underground water. And looking at statistics and looking at reading with the climate change, we've observed that with the years, so many boreholes that are not functioning, they don't function as a result of maybe the underground water levels, that maybe the water level go really down and then the boreholes cannot pump water up. So this project that we submitted recently to BMZ is a project that is one of its own kind for Habitat, that will be looking at water, sanitation and hygiene, but at the same time also looking at effects of climate change and how we can also promote the water recharge. So we're looking forward, if this project is successful, I think it's going to be a pilot project for Malawi, and we feel that it's something that is going to take the WASH program within Habitat, but again, as a country, to a complete different direction that is going to be more sustainable and with greater impact.
Thank you, Lucy. It's really interesting to get that overview from someone who has Lucy's experience as a programs manager, but it's also important to hear the experiences of those who have different roles in the projects, as a program officer or as a member of the community taking part. And so we're really, really appreciative that the Malawi team were able to capture some of these perspectives from the project on the ground, and we'd like to share those with you now. Thank you.
Dzina langa ndine Chikondi Chunga, ndimagwira ntchito ku chipatala cha Ndaula Health Center. Ndine Health Surveillance Assistant. Project imeneyi noko yathandiza kwambiri malingana ndi nkhani za ukhondo. Anthu mudzi kunoko ali ndi matoileti, komanso kuonjezera pa matoileti kuli mjigo omwe tikuona pawu mene mukuonera azimayi akutunga madzi. Mjigo umenewu utithandizira kutipatsa madzi a ukhondo. Madzi amenewa amathandizanso kuti azimayi akatunga tikayike matoileti mwathu kuti munthu akagwisa ntchito toileti asambe m'manja. Komanso kuonjezerapo, chifukwa choti atipatsa madzi a ukhondo, zikuthandizira kuti mudzi wathu uno anthu akhale athanzi, asamakhale odwaladwala chifukwa choti akuti akumwa madzi otetezeka. Ndiye pakungoonjezera, chifukwa cha project imeneyi yathandiza kwambiri pakati pakudera kunoko sitinaoneko kesi iliyonse yokhudzana ndi kolera. Ndiye project ya WASH kwathu kuno kwa Masumba Mkunda mudzi wa Songabere ku village Nkalema yathandiza kwambiri. Komanso ifeso achipatala yatipeputsira ntchito kumbali yoti anthu sakudwaladwala. Mawu amene ndingapititse kwa madonors amene abweretsa chitukuko ichi kunoko, ndionena kuti ifeyo kunoko ndife wothokoza kwambiri. Mudzi wathu kunoko ndi wothokoza kwambiri chifukwa cha chitukuko chimene chabwera. Mmene ndanenera kale kuti zathandiza kuti kwathu kuno kukhale ukhondo. Chifukwa choti anatibweretsanso matoileti, anthu apanga adopt njira zimene wanatithandizira kuti tizikumba matoileti atsopano, matoileti okhazikika, matoileti onena kuti amatenga nthawi yayitali, toileti chaisanati. Anthu mwa iwo wokha apanga adopt akukwanitsa kutani kukumba matoileti. Ndiye uthenga wopita kwa madonors ndionena kuti chitukuko chimene abweretsa kuno chisathere pompa. Ngati pali zina zonena kuti akhoza kutichitira abwere, komanso asabwere kuno kokha, koma apite ndithu madera ochulukirapo chifukwa chonena kuti ntchito iyi ndiyothandiza kwambiri. Mongomba kota kamba nkhani ya sanitation ngati hygiene ndi nkhani ya behavior change. Behavior change singangochitika in one night. Zimatengera anthu kuti chinthu chija chilandira bwanji kuti anthu aja asinthike. So my plea to the donors is for more funding so that in each and every village there should be enough people with sanitation, hand hygiene practices.
Aduguru follow mudzi mwakabuta faresi menyani monse makonde nyansi komalera anasiya ndatimangila nyumba zole eno kakubana nimpa mwini pena nimpongozi ndiye mpongozi chitamba ichiwe chitamba kalibwa lero anidikilalo wamo uzuluka benalilo wamo ule mumene menemu ugalo wamo ukumwana mumamuziratu kuruta panga sakoso ulengedo tutiremo kurusa nincenga eya ndiye mwechidule ndangotenga mtenga ujo upali mmaphalikisa eya mpulusa lichi utiremo uruluko kasambe mani eya sijangaji chilakwana miezi 9 nimbafula basi ntafula nupita navo kuti kumunda kudimba eya ndiyo nchitangaji mbudzi changaji mwayika wochokera kwa mnu wache kwa mulungu chisankho chinoona kuti chanibwera nkuto zikomo kwambiri zosoneka zimene ali siweja wena ine naziona maso chisomo cha mbuye.
Ine dzina kandelapo nesembelezani ili mzaka 20 ili ni wana awiri komanso ndiva banja imachoka mudzi mwatsangani mavula marima kumana nawo anali ovula madzi timatunga mvitsime ndipo litunga mvitsimere limangodyala matenda osiyanasiyana ndipo pano paitabwera habitat yathu tione kuti matenda waja achipa komanso tili moyo waufulu wa thanzi tikuyamikira habitat imeneyi pazimene adatichitira kolera amene anavuta dera anzathu dethu ino kulibe chifukwa cha habitat imeneyi tiliwayamira kuti habitat imeneyi ipitirize kumadera wena kumafe tili okonja pazimene adachitira habitat matenda kwathu kuno achipa chifukwa cha habitat komanso ndiye kuti adatiphunzitsa kumanga kwa habitat malusa adirawo malusa azimbudzi imene adamangira ndiye kuti ife nsadatanga uluso limene lija limene damanga changa chimbudzi ndeli ndichi chimene ngoti inophunzitsa kukhonda kwabwino ndafuni kusamba m'manja ni sopo komanso ndiye kuti za matenda wathu amene timadyala akolera palibe tingomva kwanza thuku adyala matenda akolera kumfe tibodya okolera chifukwa cha habitat yathu imene adatibwetsera mudzi muno mwansonga abeli ambapo tiloyamika tuli lothokoza zimene tichitira habitat zikomo kwambiri vuto lathu linali doti mvula itabwera ndeti ni mtenga dotili ndeti madzi aja amadzala mchimbudzi muja ndiye kuti ngomzepo zoti adzala lowe chimbudzi chenu udilizika ndeti atabwera habitat yatiphunzitsa maluso amene amamangani njwera pansi kudadzepangizone kuti sizidagwenso ayi ndafuna dalinge luso la habitat imene adatichitira fenso nomanga kochathu mchimene chili pamene pachi.
Really happy to hand over now and to introduce Ilima Gondwe, who is Habitat Malawi's WASH coordinator. She's going to be talking about and celebrating some of the successes that Habitat Malawi and the communities they've been working with and for have been able to achieve together in the projects that have been delivered, and some of the innovations too that have had a real long-term impact. Thank you.
My name is Ilima Gondwe. I'm the Water, Sanitation and Hygiene Coordinator working with Habitat for Humanity Malawi. I'll share a presentation on our WASH programming as Habitat for Humanity Malawi. So just a bit of an introduction in terms of I'll introduce to you about access to water, and then I'll talk about sanitation and then hygiene. In terms of access to water, access to safe water and good sanitation is essential for good health, welfare and productivity, and is recognized widely as a human right. Just a bit of a background in terms of water facilities in the country. In Malawi, we have about 60,300 boreholes and about 13,000 protected dug wells and 100 rural gravity water fed systems and 265 protected springs. But These are what we can say safe water sources, but we have a lot of unsafe water sources in form of shallow wells. So you will notice that about 11% of the population are still accessing water from unprotected water sources. And also out of the registered water sources, 54 are functional, and 20% are partially functional, and 20% are not functional, and 6% are abandoned. So you see that despite that we have a huge number of water sources, but the functionality rate is a huge problem. In terms of sanitation, we are doing better in terms of sanitation, but we are still lagging behind in terms of hygiene. You will notice that 73% of the population still do not wash hands with soap. Despite that, only 6.7 are the ones who do not have latrines. So you see that a greater percentage of the population have latrines, but in terms of hygiene, it's still a huge problem. And you will see that as I go through the slides, there are high numbers of waterborne diseases, and basically it's because of lack of access to safe water, but also the hand washing part, which is a big problem. And over the past 2 decades, Malawi has achieved remarkable strides in terms of sanitation, and also but like I said, a big problem in terms of hygiene. Now linking water, sanitation, and hygiene to health. Okay, so according to the Ministry of Water, Ministry of Health in Malawi, the country reported about close to 60,000 cases of cholera, with cumulative deaths of around 1,700 people. That was just between March 2022 and July 2023. So you could see that within a stretch of a year, there were high cases of cholera, and this is attributed to terms of water, sanitation, and hygiene. So this only tells us that a huge percentage of people in Malawi, the deaths that are there in terms of waterborne diseases, they are hugely related to water, sanitation, and hygiene. And currently, at the moment, we see that around 80% of the deaths in children is related to waterborne diseases, and 12% of the deaths nationwide is related to waterborne diseases. That just clearly indicates that WASH has a very huge impact on health. So just a bit of some of the milestones that Habitat for Humanity Malawi has done in terms of WASH for the past 6 years. I'll just give just a snapshot. We've done community WASH, we've done school WASH, we've done WASH related to disaster and risk reduction, but also WASH and health. In terms of community WASH, it was just the country program targeting community WASH, especially in communities, that is drilling boreholes, sanitation in terms of community-led total sanitation, and hygiene. So in community WASH, we have targeted a total of 34,000 people. And in school WASH, over 21,000 learners we've supported with the latrines, as well as sanitation and hygiene. In terms of our support to DRR and WASH, we have targeted over 3,800 people have been reached. In terms of health and WASH, our main focus was health in schools. So we reached about 16 schools. And we have also done environment and health, environment and WASH, we've reached about 9 schools. So you can see that in terms of our WASH programming, we are trying to reach all the sectors at community level, school level, disasters, because WASH also has a very huge impact when a disaster strikes, health as well as environment. But also as a country program, we have celebrated successes. I will just give you a snapshot of some of the things that we have done, some of the innovations that we've seen in our programming. The first one is to do with sustainability of water points. It's one thing to support a community with a water point, but also it's another thing for that water point to be sustainable and to be functional. If you heard me in the first part, I talked about functionality, which is a huge problem. So for us as a country program, what we're looking at is we give a community a water point, but we also want to make sure that that water point is sustainable over time. And something that has a very huge impact on sustainability of a water point is the funds to support that water point if it's broken down or if it needs maintenance issues. So what we've done, and what the study that we saw, was that most of the water point committees were failing to keep money because either banks are far away, they will collect money within themselves in the community. But what we noted was a bank could be very far away from where they're staying. You know, these are rural communities. And also some of them are not, they don't have that confidence to go into a bank and bank the money. So they ended up keeping hard cash. So we said, an alternative, what can we do? We said, okay, can we use mobile banking? We've got several banking mobile companies in the country that have initiated the mobile banking. So what we've done is we have empowered communities to keep money in a mobile bank. So it's closer to where they're staying, and also it's easy to manage. They collect the money and they put it in a mobile bank, as long as it's transparent, but also we make sure that the people that are collecting money are accountable. And what we've seen in the past 3 years is over $400 have been saved in a single water point committee. That's at a village level. So that's a lot of money that the water point are keeping. And we also encourage them that they should also buy spare parts in advance, small spare parts, so that anything happens, they should be able to repair their boreholes. So that is helping us in terms of functionality. But also something that we noticed over time is we construct a borehole, but there's a lot of wastewater that is being generated from a borehole. And what can we do with that wastewater? So what we said was, okay, instead of just doing a normal soakaway pit where water is just being drained, we put channels, and that should channel water to a vegetable garden. So that those vegetables are supporting in terms of nutrition within the village, but also that water point committee is collecting funds to sustain that water point. So what we are trying to do is sustainability as well as functionality of a water point. And another thing now in terms of latrines, most of the areas that we've worked with, we've seen that you can initiate a process of people constructing latrines on their own through community-led total sanitation. But one of the challenges that we've seen is every year when the rains come, the water facility is not strong enough, and eventually what happens is next year they have to construct another one, and that is expensive. As much as they'll see that doing just an ordinary toilet, as long as they have a latrine, is okay, but that mentality of every year constructing a new latrine is costly. So what we did was we introduced latrine designs that can be easily replicated within the community, but also latrine designs that they should also benefit them. So for us as Habitat for Humanity Malawi, we have two types of latrines. We have the core-belt latrine and the Fosatena latrine. Just quickly about the Fosatena latrine. A Fosatena latrine is an ecological latrine. So we are supporting them to know this type of latrines, that as they're using it, they will also generate manure out of it. So the latrine should have a benefit, a cost benefit from it. So we've seen that people are inclined to it because, you know, in rural areas, most of them are farmers, I should say. Almost all of them, they depend on farming. So these type of ecological latrines have a very huge impact on them in the sense that they're also generating manure. And we have the core-belt. It's a latrine that is sustainable, and for it to fill up, it will take close to 20 to 30 years for a family of 6. So you'll notice that it will lessen their impact of every year trying to construct a new latrine. And we have also done community sanitation marketing, in which we want, if a household has constructed a simple latrine, if they have been able to generate money, they should come back and say, okay, I need a better latrine. So they can choose a latrine model and then they can construct. We've done this through our local artisans. We have empowered local artisans so that they should know this type of designs. So it's easier for a community member just to reach out to a local artisan and say, I want a Fosatena, how much would it cost me? So as much as when we are designing, we would put structures like iron sheets, which we know they're expensive, but what we are looking at is the substructure that should be more sustainable. And what they put on the superstructure, we know that it's something that they can afford, but what we want is a latrine that has a design that is more sustainable. And then another thing that is also a success for us is capacity building. I talked about the issue of the mobile banking. We have empowered community structures so that they are able to know. If you go to a community these days, in terms of our areas, you'll find out that we have women and men that when a borehole is malfunctioning, they should be able to quickly fix it on their own because we have built their capacity. And we have also built the capacity of what we call the area mechanics. These are mechanics that are living within the area, so that if a borehole has a malfunctioning that the water point committee is beyond their capacity, they will quickly reach out to this person and this person will come and quickly support them. And what we have also encouraged them is they should do an annual service contract so that a borehole is serviced. Not that they should wait that it should have a problem and then they fix it, but every 4 months he comes in just to service the water point. So this is also something that we are seeing as making a very huge impact in terms of access to water. In terms of sanitation, I spoke about community-led total sanitation, which has helped us a lot. And I'll talk about hand washing. As much as we've supported the communities with access to safe water through boreholes, but also the latrine designs, we have also promoted hygiene because it's not complete if you have a toilet, you have water, but you're not practicing hygiene. And we have encouraged people to design various types of hand washing facilities that they can be able to manage, but also should help them. So we've seen a very mushrooming of a lot of hand washing facility designs, and people are washing hands with soap. And it's something that slowly it's becoming into a habit that people should know that I wash hands at critical times with soap. And just for Habitat for Humanity's Malawi Future programming, what is it that we're looking ahead in our work? So we are looking at, we want to go beyond a borehole. Currently, we have been doing normal AfriDev hand pumps, which is a normal hand pump. But what we have seen is we are not able to reach other communities. For example, if we have a community where that area, the water table is low or the yield is low, it means that community will still struggle to access safe water. But what we are trying to transition now is an AfriDev hand pump to a reticulated system. And this, for us, we've seen that it's more sustainable because we have a system, and that system should be able to should create various taps that will reach several villages. That means even that village that do not have water because of other groundwater issues, they should be able to still access safe water. So this is also a direction that Malawi as a nation is taking, so that we implement a system rather than a single borehole. It's easy to manage, but also we are supporting to reach even more. So we would want to do 4 systems that should be able to target 24 communities. This year, with the support of the German government, we are doing 1 system in one of the areas that we're doing. But also improved sanitation through sanitation marketing and support vulnerable communities. We've seen that as much as we can push for people to have latrines, but they're always the most vulnerable in the areas that may not be able to do that. So as Habitat for Humanity Malawi, we would want to support those pockets of vulnerable communities that do not have that capacity, financial muscle to build a latrine. So we would want to reach about 400 households, most vulnerable, to support them with latrines. And we also want to do community-led total sanitation. This helps us to reach people by making sure that they, by themselves, are triggered to say, it's a must that I should have a toilet. It's important that I should have a toilet. It's important that I should wash hands. So people should have that mindset to say, I need a toilet. I need a hand washing facility. So we are doing this through community-led total sanitation. and would want to reach a total of 4 traditional authorities in the district. But something also that is very crucial for us is groundwater monitoring. We have seen over the years that, yes, we've done a very huge impact by providing access to schools, communities, but we're doing less in terms of monitoring the groundwater that we are tapping. So over 20, 50 years going ahead, we don't want just to be tapping water, but we want to see the movement, that how is the groundwater doing? Because a borehole can be sustainable because communities are fixing it, but if there's no water in the ground, that is may not work. So that's why you see us that we are trying to link environment, water resources now to wash and groundwater. So we would want to have groundwater monitoring initiatives and systems so that we manage groundwater through the communities that we're working with. We'll do groundwater water resources management as well as groundwater monitoring systems. We would want to do this in one district, but also advocacy and influencing. As Habitat for Humanity Malawi, we cannot reach everywhere, but we want that the work that we're doing should have evidence. And in most of our work, we want to make sure that whatever we are doing, the impact that we're making, we should be able to influence other WASH partners in the district so that these efforts, other people should also replicate and do them. So part of our influencing work, we would also want to work with the national level. And also school WASH is very critical for us because the learner should have good access to safe water, sanitation, and hygiene at school. When they go back to community, we want them to also have safe water. So we are also targeting to reach 4 schools in terms of school WASH. And then rehabilitation, I talked about a lot of malfunctioning boreholes. These ones, as Habitat for Humanity Malawi, would want to support in rehabilitating malfunctioning boreholes. And then lastly, livelihoods. You see that we've done a lot of issues to do with gardening, but we want to make this bigger because it's linked. If a community does not have that generating power to generate funds for a borehole or for a toilet, they may not be able to have a toilet. They may not be able to sustain a water point. So we'd also want to integrate livelihoods and WASH programming. So even in our current projects, we are encouraging tree planting and gardening, but also village savings and loans. So it's part of empowering communities so that they should be able, they have a water source, but they should also be able to be empowered to stand on their own and build a toilet that is sustainable and also manage their water point. So in brief, that's the future that the Habitat for Humanity Malawi is looking at in terms of WASH.
Thank you so much for joining us today for Building Healthier Homes in Malawi. And thank you so much to the Malawi team for their time and expertise being part of this event and making it possible for us to share with you the ways in which your support makes a difference to the work that Habitat does around the world. If you'd like to stay in touch and find out more and you're not already signed up to our newsletter, then you can visit our website and sign up today for updates. And if you're not already connected, you can follow us on all the social media platforms, Habitat for Humanity Great Britain. Thank you again for joining us today. Our next online event will be on the 8th of March for International Women's Day, and we hope to see you there. Thank you.